Hello viewers, now you're watching BBC News with me, Amirah Dinda. We'll give you the most update and factual news. And here's the news for today. COVID-19 cases in Indonesia have decreased since the second wave occurred in July 2021. The spokesperson for the COVID-19 Handling Task Force, Professor Wiku Adhisa, stated that the decrease in COVID-19 cases was related to the cooperative collaboration of all parties, both the community and the government, in regulating the COVID-19 cases. Despite the fact that incidents have drastically decreased, Wiku assured that the government would continue to adopt health protocols and COVID-19 vaccinations. He added that in the future, they will concentrate their effort on downstream patient care in order to minimize mortality and boost recovery as much as possible. Wiku has previously stated that the COVID-19 pandemic in Indonesia was under control. This evaluation is based on data from the established of metrics for dealing with COVID-19. Wiku said that this week, positive verified cases of COVID-19 dropped dramatically, with active cases falling below 1% for 5 days in a row. Wiku stated that this is a really good achievement and result of all hard work, considering that we previously reached around 56,000 cases, with active cases up to 18% in July. Wiku added that in addition to the drop in COVID-19 cases in Indonesia, the government is dedicated to increase the number of tests in Indonesia in order to detect more cases. He claimed that the number of COVID-19 tested in Indonesia had surpassed 1 million in previous week. This indicates that the number of individuals tested in the country has increased since the last statistic, which ranged from 600,000 to 900,000 people. The COVID-19 positive rate is affected by increased testing capacity. The weekly optimism rate has already reached 3%. This is Indonesia's lowest weekly positive rate during the COVID-19 pandemic. Wiku noted that with all of the advancement in the indicators for dealing with COVID-19 in Indonesia, the COVID-19 pandemic can be considered to be under control. This, of course, will not be possible until the entire community and sections of the government work together. And there is a significant role for health workers who are always on the go to deal with COVID-19 patients. Although statistics for dealing with COVID-19 in Indonesia are improving, we could advise all parties not to be complacent, especially when it comes to executing health protocols. Based on data from a variety of nations throughout the world, COVID-19 cases could rise again anytime. For example, in New Zealand, as of June 1, 2021, active cases of COVID-19 in New Zealand were only 0.6%. Meanwhile, in early September 2021, there were 750 active cases. It shows that COVID-19 cases could rise anytime. We could underline that the improvement of COVID-19 cases must be maintained with discipline in adopting health protocols, because there is no guarantee that the current success in dealing with COVID-19 will persist permanently if it's not balanced by consistent and continual improvement efforts. Alright viewers, that's all the news for today. If you want to know more about our news, you can check out on our website at www.bbcnews.com. I'm Amirah Dinda. Thank you for watching and have a great day.